Good morning, everyone, and welcome to our online event this morning, What's Next? How Coronavirus is Reshaping Public Health Policy. My name is Eric, and I am with FIU in Washington, D.C. It's a pleasure to have you here today. I do want to make sure you know this is the second part of our webinar series on the coronavirus pandemic. So if you go to our YouTube page, which is just simply FIU DC, you can find part one, which was analyzing the CARES Act with guests from the US Senate and the Brookings Institution. I also want to give a special thanks to the FIU Alumni Association, through which some of you in the room today most likely heard about this event as being FIU alumni from relevant majors to this topic. So thank you so much, Alumni Association, for your partnership. For those of you who might be interacting with FIU in DC for the first time, I want to make sure you know a little bit about who we are and what we do. And our pillars are really three. One is solutions. That's federal advocacy for FIU's preeminent research priorities and for federal programs and partnerships that support student access. Our idea exchange is programming which convenes key stakeholders, both from FIU and from national organizations, on dialogues so we can exchange ideas on issues facing South Florida and the world. And the third pillar is our talent lab, which is us preparing students to be top talent in DC-based careers through internships, flying seminars, alumni mentorship, and programs like this one. Some exciting announcements from our talent lab, whether you are a current student who might be able to take advantage of these programs, or also just as general information for our alumni and supporters of the work that we're doing and the new programs that we're launching. This fall, we'll see the very first cohort of our Hamilton Scholars Program, an internship semester program, where students will be supported by both a paid internship and an FIU in DC scholarship, have some shared housing options, an in-person class in DC, and more. Information on that is on our website, and the deadline to that has been extended through Monday. And next week, we are hosting our first ever virtual flying. We have about 500 students a year who typically come through DC in person for 3-day seminars focused on a variety of topics. We are excited to do our first ever virtual flying next week, and some students are applying for that through the end of today. And you can read more about that on our website as well. We have specific websites for both of these programs, and we're expecting 40 to 50 students to be participating in that program. We're excited to do it. I want to introduce today's session by letting you know some of the key people in the room that will be participating. First, and just not in order of importance, but just because I'm speaking already, I thought it'd be good to introduce the FIU and DC team. Well, I want to give away that. The FIU and DC team. So I'm Eric, the Associate Director of FIU in DC, and among other things, focusing on our students and our talent lab programming. And my colleague Carlos is here. He leads all of our initiatives here at FIU in DC. I want to give a special thank you and welcome to two of our alumni that work at the U.S. Department of Health and Human Services, Aman and Nicholas. They both work in the Office of the Deputy Secretary, and one of their colleagues is joining today. We're very proud of their roles at HHS and their partnership in DC, where we not only are able to partner with HHS on programs like today's because of them, but we've also been able to bring students to visit the office on fly-ins, and we're just very happy to have them. So Nicholas and Aman, thank you so much for your help and for being here. Our moderator for today's program is Dr. Yolangel Hernandez Suarez. She is FIU's Vice Provost for Population Health and Wellbeing. And the panel that she will be moderating consists of Kunal Rambhia, who is a biotechnologist at the MITRE Corporation, Mary Jo Trepka, who is the Professor and Chair of Epidemiology at FIU's Stempel College, Public Health and Social Work. And joining us a little later in the program at 11:30 a.m. is Will Brady. Will is the Chief of Staff to the Office of the Deputy Secretary at the U.S. Department of Health and Human Services. So we look forward to having him on the line in a bit. And of course, perhaps the most important participant of today is all of you. So there will be chances for you to ask questions when Dr. Hernandez Suarez prompts questions. You can either chat them into the chat box. You can also raise your hand. And when she calls on you, you can unmute yourself to ask a question via video. We're also glad to have you introduce yourself over chat as we get started. So feel free to go ahead and put in there anything about your affiliation to FIU, your interest in this topic, and if you happen to be in a career or academic program that aligns to this topic, and anything else you'd like us to know about yourself. So with that, I'm going to get out of the way and turn it over to our moderator, Dr. Hernandez Suarez.
So good morning, everyone. Thanks, Eric. I am Dr. Yogi Hernandez Suarez, and I sit as the Vice Provost for Population Health and Wellbeing. It's extraordinary to be with you all this morning. I'm continue to be impressed with the ability of FIU and DC to convene really top-notch people to help us understand what's going on, and particularly in this unprecedented time of complexity for our country. It's great to be in an institution that can bring the brightest and the best across multiple sectors, not just higher ed. As you'll see, we have panels from the panelists from the private sector and from government, as well as from academia, to try to figure out what is next. And I think this is keeping all of us up at night. Other than everything being different and the chance to respond to the disruption that is this pandemic for our community, our country, and the world, you know, we must sort of stick together and figure out how our core values are going to get us through this. And we're delighted to have friends and partnerships across industry and government to help us think this through. So with that, I will start with Kunal, who comes to us from the MITRE Corporation. And I think it's worth having a moment, Kunal, just for you to center us on who is MITRE and why it is appropriate that you and your company are spearheading an unprecedented public-private partnership to help us think through what we've been through and what we should be doing in the next 18 months to 2 years. So if you could sort of tell this audience about MITRE and then share with them some of what you shared with me about what MITRE is doing in partnership to help us think through the next few months.
Thank you, Dr. Hernandez Suarez, and really appreciate Eric and Carlos for reaching out to MITRE Corporation, and excited to join you as well as Dr. Trepka and Mr. Brady later on. Appreciate you having me here. Yeah, let's get right into it. I think that there's a lot that obviously we could talk about here. The MITRE Corporation is a nonprofit organization that serves as a trusted advisor to the federal government. So in our typical day-to-day role, we are serving as technical advisors to the various agencies that are trying to bring innovative solutions to to solve many of the problems that the agencies have. So we operate what are known as federally funded research and development centers, which allow us to have a very close relationship with the federal government and to provide unbiased technical expertise in ways that a lot of other entities can't. So that's what we do on a regular basis. What's really interesting in what MITRE is doing now is that, you know, recognizing in early March that the COVID-19 pandemic was coming and it was coming fast, and that it would require a whole of community response, meaning the federal government, the private sector, academic sector. It would really require everyone to bring their resources to bear. So our organization, in partnership with the Mayo Clinic, stood up what's known as the COVID-19 Healthcare Coalition. And this is a private sector entity that is now 800 members and strong and growing. And it represents the notion that the private sector has a lot to offer and can move at a speed at which other sectors can't. And we're really here to supplement and complement the efforts at all levels of government to bring data analytics, to bring knowledge and best practices around healthcare, and to bring novel solutions to what's needed in what's really an unprecedented situation with the COVID-19 pandemic. So I will stop there, and I can certainly go on and on and on about what we're doing, but Dr. Hernandez Suarez, you know, I'll pass it back over to you to see if there's something specific you want to talk about.
So sure, thanks, Kunal. And I think, you know, this is a savvy audience that understands the particular complexities of doing public-private partnerships. And I've spent a career in and out of public service and have really learned a lot from being in the private sector and the pace at which it moves and the resources with which it can act. But I also appreciate the particular peculiarities of the interface of public and private work. Can you just talk a little bit about 800 folks working together or 800 organizations? That just sounds extraordinary to me. And just for this audience, a little bit of the process that brought you to that. I know that the pressures are unprecedented, but that doesn't mean these things always work. So for this audience, it would be really good to understand how you went into this and what of from the process perspective, what made you think this was going to work?
Yeah, absolutely. You know, it really comes down to, you know, the leadership recognizing that this was needed and having that impetus to stand up what ought to be an impactful and data-driven effort. So we were fortunate to have, you know, good leadership within our organization, as well as, you know, across all of our partners, recognition that in instances where companies may typically be competitors, whether they're tech companies or healthcare companies, that in this instance, it was important to work together and bring all the resources to bear. So it really started with that message that we're doing this for the public good. We have a few ground rules for our organization that everyone shares openly. There's no money exchanged, and that data and best practices are shared widely. So it was really setting the stage that these were the ground rules. If you can abide by them, great, you're in. Verbal agreements will suffice in the beginning. And if you can't, then we respect that. Not all organizations can abide by those rules, and everybody kind of has their own, you know, their own set of priorities. But if you can accept those rules, we've been very inclusive and bringing people to the table. And I think that also, you know, brings a little bit of comfort where if we're asking organizations to potentially share data, that they know that it's going to be used for the public good and not for competitive purposes. And so that was really establishing those principles early on was important for us to be able to create something that was sustainable and impactful in otherwise what might be a competitive environment.
So I love that. So I hear you say things that I say a lot. So, you know, leadership, right? Previous relationships and people understanding who MITRE was as a convener, and then a set of ground rules that, you know, that people are sticking to, right? That you know, you're either in or you're out, and this is the way that we're going to do this work. So that's great, and I look forward to everything that's going to come out of that brain trust. So anybody who reads the paper sees the complexities and the challenges that we're having with data in this particular pandemic that we're facing. Part of it has to do with the way that our public health infrastructure is set up in the United States. Part of it has to do with the limitations of the testing that we've seen. Part of it has to do with regionalities and the federalism associated with this response. So help us think through how that kind of mighty brain trust and convening power is thinking through data, and what kinds of data, and looking forward, how can you leverage those data to help us understand next steps?
Sure, and that's really, the crux of it is that data should be driving decisions. So we're really focused on bringing whatever reliable data sources we can to answer questions that are otherwise difficult to answer in this pandemic, where so many things are unknown, as you mentioned, around testing or around counting cases. So there's a couple ways that I would answer that question. One is that we have tried to remain focused around a couple of principles, which is that we are trying to do two things. One is keep the healthy public healthy, and the second is to take care of the sick. And if we can align all of our data around those two elements, I think that's how we can really drive decision-making and impact. So it's having those guiding strategic principles that does this data help us make decisions around keeping healthy people healthy or taking care of the sick? So that's one answer. The other piece of this is that, we're talking about potentially large data sets, whether it's case counts or human population data, vulnerability of underlying populations, mobility. There's a lot of disparate data sets that may be defined differently. So we've been fortunate that all of our partners on the technology end have opened up their tools kits for us, have opened up cloud storage, have opened up a lot of things that we may not have had access to otherwise, and have facilitated the sharing of data in ways that, again, organizations that aren't used to sharing data or aren't necessarily comfortable with sharing data, they can do so in a fast way, and they can facilitate the organizations that have analytic capability to then use that data to probe it for trends or to probe it for questions, and to then communicate that back to the public or to the decision makers.
And Kunal, obviously we sit here as higher ed, right? That's our job, and we're the future pipeline of your workforce, we hope. And so how do you see this? I mean, I'm hopeful that this is a lasting database, right? That this doesn't like poof disappear after the immediacy of our needs, because the richness of the data that you've convened is not easily put together under normal circumstances. So how do you foresee interaction then with higher ed and academia, once the smoke clears a little bit of the immediacy, to start to think completely differently about how we leverage big data for the common good? I love that, keep well people well, help sick people. This, we should all have this tattooed, right? So having said that, then, I'm an OBGYN. I've spent a career in taking care of women. First, in the early 90s in fee-for-service world, and increasingly as we've seen changes of women moving or our country taking care of pregnancy under Medicaid. So we've seen how healthcare is being paid for in this country change radically over the last few decades. We have yet to see how data infuses payment structures in a big way. So how do you see us leveraging those big data sets now to rethink payment structures, which I think are going to be far more in cost containment and less in revenue enhancement?
Yeah, that's a great question. It's a big question. So
it's a big question.
Yeah. And I'm certainly not an expert in pay structures for the healthcare system, but I can say that there's a lot of the data that's being created is from publicly available data sources. What's new and different is the way that data is being curated and potentially layered on top of different data sets that you're not normally seeing data layered on top in that way. So I think there's a ton of opportunity for academia to come in sort of in this, either in this latent period once we've passed the first wave, or even as we move forward. And we do have academic partners in our coalition as well who are very interested in this and are already accessing some of the data sets that we have. But there's only so many questions that we can answer now, here and now, in the near term. And we all have sort of, limited time in the day and limited capacity.
Sure, of course.
To do what we can right now. But, even as students, I think there's an opportunity to access the data sets that are available on our website, c19hcc.org. There's a great resource library. There's data sets that are downloadable. If you have an idea or a question or something that would make up a thesis project or something, there's an opportunity now to start playing with that data and to ask real questions that they may take longer to get the answers to, and so they may not be useful to save lives now, but they could provide valuable insights to, we're probably going to be dealing with this for, more than a year or two. Mm-hmm. So those insights may come to bear fruit later on that are extremely valuable. And I think that applies sort of across the board, is that some of these data sets are certainly proprietary, and they may disappear once the pandemic is over, but the relationships won't. And I think that's key here, is that, you know, we're bringing together competitive organizations within different industries, and they've expressed to us that they'd like to build something that's more enduring than just for this pandemic. So I think there's an opportunity here, both for the academic organizations such as FIU to allow students and encourage students to play with the data, as well as, you know, the private sector as a whole, to figure out ways to answer questions that are difficult to do in crisis, but can be done in peacetime in advance of the next crisis.
So that is great, and I hope that's as energizing to everyone on the call as it is to me, because wonky people love data. And somebody posted on my Facebook, one of these pictures. What do we want? Evidence-based policy. When do we want it? After peer review, right? So this is what we all want, and the future workforce is on this call. I'd like to open it up either through the chat, or if you raise your hand, I can acknowledge you, and then we can ask, the audience can ask Kunal some questions directly. Don't be shy. Kunal is a good guy.
I see Gabriel with their hand up.
Hello?
Go ahead, Gabriel.
Okay,
Can you just tell us who you are briefly?
well, my name is Gabriel. This is my first year at FIU, and I'm a physics major.
Welcome, physicists.
Thank you. Well, I wanted to know, how likely do you think it is that there's going to be like a second wave in the fall?
Sure. Great question. And I'm sure that folks have seen sort of the news reports predicting either different outcomes or different timings of different waves. We're really in an unprecedented situation. We've experienced a flu pandemic about 10 years ago, which was largely seen as sort of a trial run because it didn't result in the level of mortality that it could have. But aside from that, we really haven't seen anything like this since 1918. So there's two ways that I might offer an answer to that question. One is that if we look at what happened in 1918, we could likely expect another wave in the fall. That being said, the other component of this is that coronavirus is not a flu virus, so there's not a direct line that we can learn from flu. It really is. It's going to depend on a lot of things. We saw with SARS-1 back in the early 2000s that this virus had similar pandemic potential, but for some reason that didn't turn out to the global catastrophe that COVID-19 has. And there's, some interesting science behind that with respect to what happened genetically to the virus, as well as the measures that were taken to contain the virus at that time. So, if I had a crystal ball, I would certainly give you a more definitive answer. But the real idea is here that we've gone through a first wave. We are seemingly coming out of that first wave now. The non-pharmaceutical interventions that were put into place seem to have a strong effect in flattening the curve. We don't have any idea of how many people in the population have been affected by this virus. Nor do we have a strong indication of how durable the immunity to the virus is going to be in people that have recovered. So all those things into consideration, I don't think it's safe to say that we have reached anything close to herd immunity. And that's the concept that once a certain percentage of people get the virus, that the rest of the population is generally protected. Until we get a vaccine, until we get therapeutics, I think that we should expect some resurgence of the virus in states over the summer, and then potentially a larger wave in the fall. So I hate to be wishy-washy there, but we really don't know, and that's what's really challenging about this pandemic.
And Dr. Trepka, as our epidemiologist, would you like to comment on that? And we all understand the insecurity. We don't really know, right? But from your experience and looking backwards at other pandemics that the world has faced, What are you seeing in your crystal ball?
Well, I agree that with everything that Kunal said. I think what differentiates this from SARS is that, and I think probably the big problem with this is that there seems to be a very high percentage of mild or asymptomatic infections. So that's what we've seen. We've seen, you know, the couple limited studies that they've conducted in states, in cities in the United States. There have been many-fold more people who have evidence of antibody than were diagnosed cases. So like on an order of 10 to 12. So it's always difficult to control diseases that are asymptomatic or mild. And I think that is really the problem that we're dealing with here. So
Right.
it seems that it's asymptomatic or it's mild for the majority of people. The problem is, of course, that none of us have an existing immunity to this, and it's hit us in a big way, so that even only a small percentage of people have a severe illness, that means there's an awful lot of sick people. So that's the problem. And yes, we're nowhere near herd immunity. Not even New York is anywhere near herd immunity. And we know what New York has gone through to get about 20% of the population showing evidence that they were infected. And then, yes, and obviously the other problem is we don't know what's going to translate to immunity. We only have evidence of antibody in some people. So the crystal ball is only blurry.
Yes, I hear you. So, you know, barring herd immunity, there's a question on the chat then about treatment, right? And so, you know, come and go as far as treatment is concerned, none of which I think are bubbling to the top yet. Kunal, is your coalition looking at treatment as well in your data, or how is your group approaching approaches to management of the disease once it is, if at all?
Yes, sorry, maybe on my end where the internet broke up there, but the question was about what is the coalition doing to examine treatments that may be effective.
Yes, I'm sorry if I broke up. That's
No problem.
Exactly right.
Right, so you know, I'll say that we are working hard to tackle this problem. It's not an easy problem. There's a few ways in which, you know, we can think about this. There's the things that may have you know, repurposing of existing drugs for COVID-19 treatment. You know, randomized controlled trials are the best way to evaluate those. In the absence of that, we can do some retrospective observational studies, and the coalition is looking into the possibility of doing that, and hopefully we'll have something to bear there. But randomized controlled trials are really going to give us the best information. And we saw this week in the news that Gilead had announced its first results for remdesivir and showed some potential reduction in mortality. So that was promising, though I think we still need to look at the data and understand, you know, when people are receiving it, how sick are they when they're receiving it. So, you know, if it works, that's great. There's also convalescent plasma that's come up as a potential therapeutic agent or therapy that could be used. The coalition is looking into that and there's some challenges around that in terms of getting enough plasma to act from donors that have recovered. So there's a number of issues with the near-term potential of convalescent plasma as well that we're hoping to help resolve. And then there's, you know, the question, the bigger question in my mind is how quickly can we get a vaccine? And that would really change the game. Therapeutics are great, and there's, you know, a lot of folks, smart folks in private industry that are working to develop the right therapeutics, whether they're targeted antivirals or monoclonal antibodies or hyperimmune globulin. There's a lot of things under development, but the game changer in my mind is probably the vaccine, and if that can get developed in a meaningful way in the near term. And then in the absence of any therapeutic event, And so social distancing, hand hygiene, all those things are going to continue to be extremely important. So we really want to see the effects of, as we sort of open up a little bit, what are the things that are going to happen to the epidemic curves around the country, and when might be the right time to re-implement some of those social distancing measures, because it might take longer for us to get the pharmaceutical interventions online.
Which brings us to human nature, right? And how people behave, and how challenging it is to get grown-ups to change behavior, right? This is a big issue, regardless of the pandemic. It's one of the leading problems we face in the management of chronic illness. And so how maybe I'll ask you, Mary Jo, any lessons learned or ways in which we can think about nimble change in behavior? Because it sounds to me, and you guys have seen the analogy that was put forth prior to this webinar about we got hammer time and we got dance time, and I think when we're in hammer time we seem to do okay. When we're in dance time, we know we do we're good at that. I think the issue is going to be, what are the policies that get us in and out of that quickly, and that ultimately will be life-saving? And different countries have done that differently. We've seen sort of the austere measures that have been taken in China, the completely different approach that's been taken in Sweden. Mary Jo, maybe if you could just sort of comment on that a little bit.
Sorry, my computer broke up. I didn't hear the last sentence. Comment on human behavior and how we're manage what appears to be our reality, that we're going to have times where we are social distancing in very strict ways, and times in which we this term, which I don't know exactly what it means, but we loosen and then we tighten, and then how do you think that's going to happen over dozens, hundreds, thousands of communities in our nation and across state lines, right? So let's say Florida really gets it together, but Georgia doesn't, and what does that mean, right? So the last piece broke up again, but let me just try. So I think in terms of, quite honestly, I think people have done a really good job, at least what I see here in South Florida. I've been impressed. But I think there are several things that are really important. One is, I think there needs to be unified recommendations. It's very difficult when there's contradictory things because people don't know what to believe. So I think we as a country, we have to have the leadership where we're giving out, yes, the message is going to change over time as the outbreak is going to change over time. And I think people will get that if we communicate that. But we have to be, have a kind of a unified message so people aren't so confused. So I think that's very important. I think, culture can change. People can if it requires people to be wearing masks in certain situations for the next couple of years, I think people can adapt to that. I think it's mostly a matter of having kind of a unified, clear message so that people aren't confused. So I actually have a lot of optimism that people will respond, at least most people.
I love that.
Was there another piece to that question that I missed?
No, I think that that gets to it. I know that that's probably something that Kunal and his group are looking at as well. But I want to acknowledge Will Brady. Howdy, Will Brady. You have joined us. We appreciate you here. We appreciate what you are doing in your collaboration with FIU. I'm Yogi Hernandez Suarez, and your moderator, and I'm pleased to meet you. Do you want to sort of take a second to ground everybody on this call of what it is you do and your particular role at HHS and how it interfaces with our current reality? I can't hear you, Will. I don't know if others can. Can others hear Will, Brady? I cannot. No, we cannot.
I can't hear him either.
So now try unmuting.
Hey guys, can you hear me now?
Yay, we can hear you. Go for it. Were you able to hear us before?
I was. So,
Fantastic. Okay, take it away.
well, thanks, and thanks for the opportunity to just share a little bit with you all. And Aman and Nicholas, thanks for setting this up. But happy to be sharing with you all today. And as a little bit of background, I'm the Chief of Staff to the Deputy Secretary of the Department of Health and Human Services. And so generally, I work on high-level policy strategy and execution across health policy in the federal government. And so if you're not familiar with HHS, it's it's the largest department in the federal government when you measure that by funding, in that HHS is the department that oversees the Centers for Medicaid, Medicare, the FDA, CDC, the National Institutes of Health, and about 20 other sub-agencies under us. And so from a very broad perspective, we work on healthcare policy with the mission of improving the health and well-being of the American people. And so it covers everything from the approval of medical devices to paying for healthcare for our seniors, to running a 200 plus healthcare system for the Indian Health Services. And so it's a very broad array of healthcare topics, but at HHS, we touch all those things. So in my role as Chief of Staff to the Deputy Secretary, we oversee all the different policy activities from a regulatory perspective, as well as drive the management and operations of the department to make sure we're executing and pursuing our mission. So, Doctor, I hope that gives a little bit more background, just at a very, very high level, about where I sit in the organization and what the organization is focused on.
So that's great, and you know, we're thrilled you're here with us. We get you're kind of a big deal, and so we're all excited to hear how you're thinking about not just what has happened to us as a nation through this pandemic, but how you're looking forward about what it means, you know, in so many different sectors that your agency covers. So maybe if you could just tell us a little bit about how you are thinking about prioritizing the work that is ahead of you, so that, you know, ultimately we sit here as higher ed, right? FIU is your partner in academia, your pipeline of future workforce, and it would be really helpful for us to see how your bucket is ranking the work ahead and what you see as early work and no regret work around this.
Well, so one, you know, thanks for all you guys are doing. We've got some good FIU alums at HHS, but particularly in our office. And so I think, Doctor, you know, Aman and Nicholas. And so when we talk about the work, I wouldn't so much rank it, but I'd say there's multiple different work streams that are of critical importance to getting the country through the pandemic. And so, you know, at HHS, we think about those different work streams in parallel with one another. When we talk about giving people confidence in their healthcare system, you know, one of that is just knowledge and information. And that's where testing is of critical importance, to where we're constantly working to make sure the capacity for testing is increased and available so people can know the circumstances they're dealing with to inform their healthcare treatment. Another is making sure that just generally the equipment and the supplies that are needed to provide healthcare in the current environment are available. And that's where we've worked with our private sector partners to increase the capacity of public or personal protective equipment like masks, or more specific healthcare equipment like ventilators. And so that's another component. And then, I'd say another is, how do you make sure that just generally people are still receiving their healthcare and access to healthcare services in the environment where we're pushing things, we're asking for social distancing, and states are shutting down their economies to limit the spread. And so that's where there's been a lot of policies on telehealth and virtual care. And similar to how we're meeting today, we're doing everything we can to expand the options for people to access healthcare through new mediums and modalities, to make sure that all the things that we know are needed to receive healthcare can still be available to the best of the ability under the current environment. And so, I think all those things aren't ranked in order, but it's the different work streams of priorities that we know are of critical importance to get through the current situation. And make sure that people stay healthy and can receive the care they need.
So I love that you showcase that, regular sick people haven't stopped being sick, right? So I think that that's part of what, we have not necessarily seen covered in the media, is what is happening. I'm an OBGYN, people haven't stopped having babies, people, still need stuff going on. And I do think that telehealth the broadening of telehealth has been a great tool in the toolkit that we have as healthcare providers to help, address usual and customary non-pandemic illness and acute needs. I would love to hear how you all are thinking about telehealth moving forward. I just commented yesterday to my colleagues that I don't think we're going to be able to put the telehealth genie back in the bottle. And so, having said that, then do you see some of this sticking in policy moving forward? And again, as academics, how should that, if that's going to stick, then we need to understand how should we be training healthcare professionals to utilize and function effectively in a telehealth environment.
Yeah, and so I'd say this, it's one of the things we did even before this was we created reimbursement mechanisms for Medicare to actually reimburse for things like virtual visits. And this was even before the coronavirus, and this was about 2 years ago. And so I can share as somebody who's a huge proponent and advocate for telehealth and virtual care, if you try to find a silver lining in this scenario and what we're dealing with, it's that this has forced telemedicine and telehealth and remote care to advance by 5 years at a minimum.
We agree.
And so I think you're right. The genie's not going back into the bottle in any situation here. And if anything, it will help, move things forward to where ideally, if I think about it as a parent, hopefully I don't have to take one of my younger children into the doctor's office for something like an ear infection, and we'll be able to use that through telemedicine. And so I do think that things have moved so far in advance for that, which is beneficial, not just during the COVID epidemic, but just overall. And so if we think about how that applies to those in academia and those in students, a lot of this is, adopting the same channels and modalities of communicating that we do in our everyday lives into healthcare. But what that means is it's a change in behavior. And so one of the interesting things that I've heard from some of the leaders in telehealth who are doing this is, everybody always talks about bedside manner, but there's the push for website manner.
Uh-huh.
And so when you just talk about the differences of how you deliver care, and you have to have the right things, whether it be lighting or orientation or camera or things like broadband, to make sure that it's not going to be a frustrating customer or patient experience, so that it's still being delivered in the right way. And so from an academic standpoint or from a student standpoint, you have to take into account and start thinking about not just the healthcare delivery components of it, but also the more specific components about just the medium with which you're communicating. And so that's one thing that I think has forced people to address in this environment that hadn't been in telehealth, is just how you deliver in a virtual environment with the same level of effectiveness, which is a good thing to get people to focus on. I think the other thing is, how do you build trust? And so telehealth has been around for years. It just hasn't been adopted. And I can even share personally when I asked my wife, well, couldn't we just do this through telemedicine? She's like, well, there's no way I'd listen to a doctor over a video chat. And I'm like, well, look, this is crazy. But, I would encourage every student academic to say, what are the trust barriers that need to continue to be addressed to advance this, very critical and important component of healthcare that is just, gone advanced in leaps and bounds under the current situation.
Well, I couldn't agree more, and kudos to HHS. I frequently tell the students don't waste a good crisis, right? So the opportunity that HHS took to change payment structures around this and allow whatever barriers were keeping healthcare professionals from this and patients from this to open and people to experience this. I think is going to be, a sea change for our healthcare delivery system and payment system, which is great. So I see we have a couple of questions from the audience. Before I turn to those, though, Will, I would like to ask you, I think, you have a lot of policy and future public servants on this call. Tell us how you are working through all the different levels. This is an issue that goes from the White House to the mayors, right? And so HHS needs to influence all of those levels of power to get things done. And so, just tell us a little bit how you are thinking through some of that up, down, and sideways work.
Well, I think the first way you think about it is in any situation like this, the first thing to do is listen. And so you listen to what your higher level leaders are hearing, you listen to what the people on the ground are doing, and you try to take in as much information as you can, anecdotally and as well as from a big data standpoint to make sure you're getting the right information. And so generally that's a principle of just listening and making sure you're always connecting with the right people and hearing from those who are dealing with things at firsthand. And so that's the first component. And going back to building the trust in any environment like this, there's always a lot of tense situations. There's always a lot of decisions. There's a level of demand for decisions and actions that can never be met in the time that's available. And so you've got to approach everybody's situation with a degree of charitable understanding to make sure that you're working together and being collaborative. And so I think listening and having that mindset is important as a fundamental approach to just being able to effectively deliver in the circumstances, as well as, just generally when you're working in government. And so, with that, you take those principles and you start to realize that this is an entirely collaborative effort that requires all parties across the government, whether it be mayors or counties or states, the federal level to the White House, to work together to implement the right guidelines or the right protocols, and know that this is an incredibly local issue, the same as healthcare is. And so you've got to respect and understand discretion and autonomy in that regard to make sure that things are being treated appropriately at the local level. And so that requires constant communication and, as I said, listening. And I think the other thing to remember is it's not just about the government. We've done things that have never been done before in a lot of different instances. And that's because we've partnered with the private sector, the innovators, academia, and worked across, the entire country, regardless of your industry component or where you sit, to find every possible solution to solve the challenges we're facing. And so I think, as I stressed and mentioned, it's a charitable belief in everybody that they want to do the right thing to start, as well as making sure that you go with open ears when you're going in to solve these problems and understand what the actual problems are to make sure you're addressing what's important. And so, I think that's how we're approaching these problems, and coordinating amongst ourselves, and knowing that you have to have a degree of humility to know you can't know everything, and you need to listen to people and work together if we're going to be successful.
So before you came on, Will, we heard some of those very same comments from Kunal at MITRE, and obviously we share those same values of leadership, relationships, trust, and I'll add what you state is assume good intent, right? So assume positive intent, and I think that gets us a long way to work collaboratively in really what has been unprecedented times. So we know you have to get back to do the public's work, and so we appreciate you jumping on this call, and everyone is giving you a virtual clap. And we look forward to hearing from you again in this forum, and appreciate all that you're doing for FIU and your willingness to work with us and see our value, not just as students and educators, but as influencers. So thank you, Will Brady.
Well, thanks. And I just close, I think in these times, I think those in academia and students, it's an incredible opportunity to think creatively. From an entrepreneurial mindset, from a partnership mindset, and there's so much work to be done, to where I'd encourage everybody to be overly to communicate as much as possible and offer the help and share ideas. But and I was talking to Aman and Nick about this in our office, to where if you look at a similar circumstance of the economic impact in the 2008 financial crisis, there's companies and ideas that evolved from that that weren't ideas before. And so I'd encourage everybody to pursue their ideas at this time, to where there's stress and new thinking and creative solutions that are being developed. And so I think especially students have a great opportunity right now, as people are looking for new solutions, to pursue those ideas and creative thoughts. So can't encourage that enough, and thanks for the time to share, and I hope this was helpful in learning a little bit more about how we're approaching this, and also what people can do to play their part and fill their role in these critical times. So thanks again.
Absolutely, thanks, and we hope to hear from you again. Thank you, Will.
Thank you.
So let me pivot now to Dr. Trepka before we take the questions from the audience. Just pivoting on what Will stated, I mean, this is the time for young people to start to think about what this means for their careers, what they're investing in with their higher ed dollars, and where they should be doing it, where they should be networking for future opportunity, where they can have impact. So I'd love to hear your thoughts on that, Mary Jo.
Yeah, so I mean, I see that we have several phases to this crisis. We have the immediate phase right now when we're dealing with the actual virus. Then we have the intermediate phase where people are going to be trying to get back to work, and we're going to try to get our economy back up again and children in school. And then I think we're going to have a long-term phase, and that is the long-term effects of this crisis. And so we need to be thinking about the social determinants of health, and issues like poverty, unemployment, lack of educational opportunities. I think that's going to be leading to long-term health problems. So we have immediate issues with respect to the infectious disease crisis, and I think long-term we're going to have issues related, and immediate too in terms of mental health, but long-term more with chronic health and loss of opportunities. And I think we really have our work cut out for us in public health and other social services as well. I think that, you know, people who are interested in public health and other social services, we're going to have a lot of work to do now and in the future. You know, a lot of our students, and it's nice to see you all this morning, and nice to see a lot of names I recognize too. You know, so our current students and also our alums, I know they're helping out with the outbreak in terms of contact tracing and laboratory and so forth. And again, I think going forward, we just really have an awful lot of work ahead of us. So thoughts that we have had, you know, we recently started our infectious disease track in epidemiology, which has been very popular, and I think we're going to need to modify that going forward. You know, we've started an MD MPH program, so that we'll have more physicians that are trained in public health principles. And then going forward, some of the things that we've been talking about would be an undergraduate program, and also thinking about how we can better teach the skills that people need to adapt to ongoing and new challenges. I've done this long enough to see that we have this is a huge challenge, but every year there are new public health challenges, from Zika, Ebola, now this, and it's just going to continue to happen. So we need to be thinking about how we can better train our students. And I think a big part of that is talking with people working in the field about the skills and the new skills that they need, and maybe the skills that they're not seeing in the workforce that they need us to help, that we can address, so that our students are well prepared to address these many challenges that we're going to be facing.
Outstanding. And I want to acknowledge Dr. Florence Greer. I think, Florence, you had a question for Kunal as well, that came in through the chat.
Yes, hi, good morning, everyone. Kunal, I know you've written about being patient during this time, especially with your family. And as we move forward to, as I say, our newest new normal phase, what are your thoughts in terms of, we have students who are seeking opportunities in terms of being involved in public health, and with hospitals and health departments basically closed right now, students don't have those opportunities to be on site. Do you have any thoughts as far as the healthcare coalition, for COVID-19, that our students could be involved with?
Yeah, that's a great question. And you know, I think being patient is going to encompass a lot of things, both personally and professionally. So, you know, it's a tough one to unpack. I would say, you know, I'm happy to provide my contact information to this group, and invite sort of questions about what the coalition is doing, and if there are students that want to be involved, you know, if there's specific things that they're interested in when they see our website, you know, there's certainly ways for us to connect the dots to people who are smart and thinking about this, to where they can get data sources to maybe probe their questions. And I think Dr. Trepka also mentioned that, you know, people who are in public health and medicine who may still be students, they may have other opportunities to serve as contact tracers and to get training on that front, and to sort of explore opportunities that do exist even in the context of these challenging times. So I would hope that you know, the university has hopefully, you know, done some thinking about how to facilitate those opportunities for students as well. Not just for international, but more broadly, you know, like we really need to be taking advantage of the skilled workforces that we have. Not everybody can be a contact tracer. It does take a little bit of you know, knowledge and understanding about the information that your guy, like personally identifiable information. So I'll stop there and see if there's, you know, Dr. Hernandez Suarez has another thought.
Well, our unfortunately, our hour has gone by faster than any of us would have liked, but I will state that the university is thinking deeply about what this means for future opportunities for our graduates, and how we are mentoring and guiding people to careers. We are very innovative in the world of micro-credentialing, and are doing some thinking about how we can prepare tracers through a micro-credentialing strategy. Everybody get a badge and contact tracing, and it's an opportunity for our undergraduates to earn some money even as they help. So we are thinking globally about what this means for us as an institution. I want to end by acknowledging our hosts, our nice, the smart people at FIU in DC for bringing us together. I think this is, at least for me, has been a great enlightening hour. I continue to be impressed by the power we have to bring content experts together in a timely fashion. And at least from what I hear today, I'm going to focus on the fact that the future is bright. There are people who are up to the task of what's ahead of us. And I, for one, am happy to see FIU's footprint on this. Carlos and Eric, is there anything you want to add to close us out?
I wanted to once again highlight Nicholas and Aman, our alumni at HHS, both for them as individuals, but also to highlight that they are two of about 3,000 alumni of FIU in the DC area that are tackling the toughest issues every day and that are connecting with our students even while they're doing that. And we're just so proud of that network up here. I know that, we could have continued this conversation for a lot longer and with questions. So I want to say that, just point out that Kunal did put his email address in the chat for people who did want to reach out to them. I know that yourself and Dr. Trepka are available through the FIU phone book, and it's easy to get any FIU folks' contact information and to reach out to FIU in DC as well. My email is very easy. I'm Eric F. I'm Eric F at FIU.edu. So the conversation does not have to end, even though our Zoom meeting for today is ending.
I'll just add final thanks to all of our panelists and our wonderful host, our moderator, in particular with MITRE. We're very pleased with the exciting collaboration that is now getting moving and that FIU has launched with the organization. So, and we're so pleased that so many of you can join us today. Thank you all.
Be well, everyone. Thank you.
Thanks so much for having me, and great to meet everyone.
Thank you, Kunal.